So what we're going to be having a look at in the webinar today is your assessment task learner version or your assessment items for your horse health cluster. Can you see that PDF document on the screen?
Yep.
You beauty. So I sent this one through to you, and as you can see, we've got 3 assessment items for this one. Now, there's the multiple choice, an assignment, and practical or annotated photos. So you have the opportunity to decide which way you want to tackle that one. As will future students as well. So you can go, oh yeah, you know what, I've got access to a couple of horses that I can do that with. I'd prefer to do it at home. It's going to be easier for me than having to come into Wang. Or we can do it as prac, like we typically do for a workshop, where we set up scenarios and you guys can be assessed that way. When it comes to the practical, what are we on now? November. Generally, this is going to be due in the new year either way. So with the prac, if we do it at Go TAFE, we'll be looking at, potentially a January or February workshop maybe. If you're doing it through annotated photos, then it's the date would have been set within that email when it was first sent out to you. So your multiple choice should be pretty familiar with those that we're looking at, multiple choice questions where generally you've got one answer that's expected of you, unless it tells you, like in question 1, to select 3. So identify 3 signs that a horse could show if it had worms, and then you would need to highlight 3 of those. So hopefully the multiple choice are pretty straightforward with regards to answering them, but definitely if there's any you're unsure about or you feel they're ambiguous, more than happy to have a conversation around them, and you go, okay, well, this is what we would do at work, but I'm not sure that's, what's expected based on the learner resource or whatever. We can have a chat about those.
Okay.
So within your multiple choice, 14 questions that need to be done. And then same deal with this being paper-based, you've got a cover sheet that you need to submit along with that one. I guess the main one we can have a bit of a chat through today is number 2. So that's an assignment about this grey horse called George. So you've got some scenario and short answer questions here that you need to answer based on the information that's given to you. Some of them you may have to research or read through your learner resource and go, okay, how would I go about doing that? And same deal, you need a signed and dated cover sheet to be submitted with it. So it says you're working in an eventing stable, you're employed as a groom, and you're told to catch George from stable 14. So what PPE would you wear, and explain its purpose? Considering George's size, what equipment and gear should you take with you to catch him? So although you may say, oh yeah, I need a head collar and a lead rope, if you look at him up here, you can go, okay, well, he's not a pony, he's not a draft horse, he doesn't have a big long head, although he does look like he's got quite a decent jowl on him there. What sort of size head collar may I need when I'm taking the gear out? So you can factor that in as you're saying, okay, well, here's the gear I need to be wearing to be kept safe around the horse, and here's the gear that I need to be able to catch and secure George. Does that make sense?
Yep.
Awesome. Question 2 says, okay, on the 14th of March this year, you notice that George has a swollen foreleg. So he's got just a bit of a bump here around his knee area. So it's not huge, but it is a visible swelling. And he requires some bute, or the anti-inflammatory phenylbutazone. So he's supposed to have 10 mils twice a day for 2 days, and then 5 mils daily for the next 3 days. So what would you do about it? So you've just found him in the paddock and he's got this swelling. What do you need to do as an employee when you found a horse where there's something wrong with his health? So you can write down, okay, do I catch the horse? Do I report it to someone? Do I immediately give him bute because I think that'll fix the problem? What are the steps that you need to take for that? Method of administration. So how is bute given? Do we inject it? Do we give it in the mouth? Do we give it in the food? Monitoring progress. What do we do to keep an eye on him and just check him over the next few days? Do we need to be looking at the swelling? Do we need to be looking at lameness? Do we need to be looking at his general demeanour? Consider those sort of things. Number 3, your boss decides George requires bandaging for the next week to provide support and reduce the swelling. Now, I can tell you if I'm working on a thoroughbred stud, we wouldn't bandage that. That to me seems a little bit of overkill. But he's a performance horse and they really want to get that swelling down as quickly as possible and not have it flare up anymore. So they've decided to bandage him. So describe how bandages would be applied in a safe manner. So thinking about keeping yourself safe around the horse while you're popping bandages on. Considering horse restraint needs. So how do you contain him or restrain him while you're popping a bandage on? And then ensuring that they don't cause any discomfort to George. So, how tight does it need to be or how loose does it need to be? How do you go about keeping him calm and comfortable whilst you're applying the bandage? Do you need someone to help you? So just consider those processes there. B, how else could horses be restrained? to ensure health examinations and treatments are carried out in a safe manner. So if you're, let's say, restraining him with a head collar and a lead rope, and that's working fine because he's a placid old boy and he's happy with that, wonderful. But if you had a young horse or one that was really in pain, what else may you need to do to keep them restrained and contained so that you can safely carry out work with them? So, think about other items that you may use to help restrain them, or whether it's a staff member or something. Sorry, I just zoomed that out a little bit. So that's 3B. Now, question 4, based on that scenario, it says in real life, you would be required to monitor the recovery and document the progress. So using this treatment sheet, complete the treatments, bandaging and medication that George has received for the week. So it told you, I think, that the bandaging was to be done daily or every other day. You can refer back to question 3. And it told you how much beauty was getting and over how many days. So based on that information, you need to be filling in this particular document there. So, we know, for example, that it was sometime in March, I think. Okay, the 14th of March, this has occurred this year. So we could fill in the first one, 14th of March, 2020, Alison has given him some bute and put on a bandage, let's say. So the medication given was 10 mils of bute. Progress of injury, you could say, well, there's a slight swelling. Maybe you can determine, if you want to, whether he was lame or not based on that swelling. It could just be a visible swelling, or it could be one that physically you see as he's walking, there's a head bob happening. So up to you to decide on that one. Is further action required? Well, your boss has asked you to do bute for the next 5 days and bandaging for the next week. So yes, you can comment what you need to do, pop in your signature or your initials here, and then go through and fill out those 5 days there. Do note, it says here, unfortunately, on day 3, the swelling looks worse. The leg is swollen from the forearm all the way down to the hoof. So his whole foreleg is swollen and he isn't bearing any weight on the foot. Document this and your response to the deterioration in his progress on the treatment sheet below. So you can comment on what day 3, that, you can note that, well, hang on a second, it's not progressing well, it's gotten worse, there's swelling, he's non-weight bearing, or lameness associated with that leg. So we need to, maybe reconsider the course of action, or look at whether the bandage was on too tight, or what other problem could have resulted in that swelling. Maybe he's been restricted too much in his movement and the swelling's happening from a lack of him being able to walk around. So you can comment there on what further action or what change you may do with regards to his treatment, and obviously as an employee, referring back to the employer too can help to guide you on that. 5, it's saying it's spring and George is showing signs of foot soreness, shuffling in his stride, especially on hard surfaces. He's found to have a mild case of laminitis. So explain what laminitis is, and that may be one that you already know off the top of your head, but you're welcome to refer back to your learner resource and put it into your own words what it is. How would his diet be changed to help manage this problem? So what could we do in regards to what he's getting fed to help us to manage this issue of laminitis and how it can be caused? Number 6, he's recently come back from a possible exposure to strangles. He's really getting out and about, this boy. What quarantine procedures would you implement? How would it be achieved? So think about people coming in and off your farm, whether they're allowed to, if he's potentially been exposed to strangles, equipment that you're using with him, whether that's allowed to be used with other horses, whether it needs to be disinfected, what the go is there, handlers, other horses, whether he's allowed to be anywhere near them, whether it's one person looking after him or many staff members. So you can document each of those there. 7, what is a communicable disease and how can the risk of spreading be minimized? So what makes the disease communicable and how do we cut down on the chances of that being spread to other horses? And if we're concerned about one of those diseases, who would we report that to? Any questions on any of those questions?
No, but that 7-1, I answered it before in another quiz.
Okay. All right, good. So good. All right, so that could be a double up. So definitely if you find that is a double up with one of the other units, it could even potentially be prevent and treat, because that's an elective, but it's covering the same sort of information. It's quite possible, but I'll make a note of that feedback, just purely because it's good for us to have variation. Question 7 for the short answers for health. Double up. It is, if you haven't done that, let's say, prevent and treat unit, and you did the writing elective instead, then you may not have come across that one. And I guess there's only so many different ways you can get someone to answer a particular knowledge topic that they need to know. But we thank you. I'll look at that one and see whether we need to word it differently, or maybe, I don't know, come from a different angle potentially.
Yep.
Number 8 says list 6 observations you would look for anytime you check George at least daily. So what are you looking for in regards to his health? Then 9 is looking at listing what items you would have in a first aid kit and then their purpose. So there's no right or wrong for this. Many people would have different things in their first aid kit. It's just what you would have and what you would use it for that would help you to deal with a first aid situation with a horse. So there's plenty of possible answers for that one. Where should the kit be stored? How is it maintained? So where do we keep it? How do we go about knowing that everything in it is still there, able to be used within date, those sort of things. 10, looking at hoof care, explain each of the following terms and when it would be appropriate to use each or communicate to the farrier. So define what shoeing is and then why we would have a horse shod as opposed to trimming, for example. Raised bars on the heels of a shoe, what is that and why would we use that? Stud holes, toe clip and side clip. So that will be within your learner resource. And I can tell you as someone who's not very familiar with different shoes because I'm used to barefoot stud horses, this would be one I would need to do a bit of reading up on to be able to answer those questions comfortably. But just so that you're aware of the different ones that can be used, particularly on performance horses, like stud holes, for example, they'll often use for traction for stud horses when they're eventing, as opposed to race horses. I don't think typically they're used with your race horses at all. You just have your aluminium plates, really.
Yeah, sometimes with horses that have a bit of hoof cutaway, we've used the raised bar ones.
Okay, and I've definitely found that that's a good point. Definitely with maybe some of the frog or whatever that's away, and you haven't got as they're stepping down that concussion happening with the ground that's pushing or pumping the frog back, the blood back up the leg. So yeah, good point. So I think they often use that with horses that have issues with navicular, and I'm not sure if laminitis comes in there or not. Contracted heels, definitely. So yeah, good to look into those different ones. And then 11's looking at you identifying the different tools that are pictured there, and then identifying for these ones their function, what specific tool would be used for cutting away hoof wall or filing down excessive hoof growth. So you can use that based on the images listed above. 12 tells you that injuries can happen at competitions, especially after cross country. So George has just finished the cross country at Camperdown Horse Trials, and he has an overreach on the near foreheel. So if you're not familiar with an overreach, read up on that one, within your learner resource. So chances are you are, or have a bit of a research online and go, okay, well, what am I going to do about this now? So how do you go about cleaning that? And then what treatment and equipment is required? And you may find, depending on the severity, if it's really superficial, it may be clean and spray and that's it. If it's quite deep, then you'd be looking at bandaging and gauze swabs and those sort of things. So yeah, down to, I guess, the individual, you can build on that scenario a bit and say, well, actually, it's only superficial, so we only need to do this. Or no, it's quite deep, so this is the course of action that I would take. In the show jumping phase of the competition, George starts tossing his head, and it's suggested that his teeth may need assessment and treatment. So list 3 other signs that a horse may display indicating their teeth may need to be checked. So the first one you've been given is tossing his head. So what 3 other signs may he give to indicate that there's a problem with his teeth and we need to look into that? 14, how often should a horse have its mouth assessed by a vet or a dentist? And how would you record this so you can keep track of when they're next due to be assessed? 15, explain the eruption patterns of horses' teeth. So within your learner resource, it looks at the different stages and ages that the teeth come through, which teeth when, and that'll help to answer that question. 16, you need to give a 2-in-1 injection booster to George. So what would you be protecting him against if you're giving him a 2-in-1? And how is it given? So which method do we administer it? If we're storing this vaccine for a length of time, where do we need to keep it for it to be in suitable condition for us to use? So is that cupboard? Is it out in the sun? Is it on a bench? Is it in the fridge? Where would we be keeping that? 17, explain the common gait abnormalities, explain the below common gait abnormalities, and suggest what treatments or corrective farrier work could be done. So if we have a horse that's paddling or winging out, what would this look like when they're moving? So we've got that sort of flicking of the leg action where they throw their legs out, and how would that be treated or managed and reported? So who would we talk to about this, and then how would we go about potentially fixing or trying to correct that problem. If we had a horse that's lame in the near fore and we know they've got a foot abscess, what would that do to their gait? How would it look when they're attempting to walk or trot? And then again, how would we treat that, manage it? Who would we report this to if we've spotted that they're lame? And third one, you've got a shod performance horse that's well overdue for a farrier visit. So it's saying they're shod, but it doesn't clarify whether they've got all 4 shoes on or not, but they're well overdue. So it could be that the shoes are loose, or that you've got a missing shoe and you've got really long hooves. So what would that look like with regards to their movement and the hoof? And then again, how could you manage and report that one? 18 looks at documentation. With regards to vaccination. So A asks, how often should George be given a 2-in-1 booster injection? So not the full course, but just his booster. How often should he be receiving that? What if this is his first injection? So instead of it being a booster, if he's having his first 2-in-1 injection to start him on a course of vaccination, how often should he be vaccinated, or what's the process? When do we need to give him his first shot, his follow-up shot, another follow-up shot, and then his boosters?
Mm-hmm.
How would we record or document this information? How would you know when he's next due for an injection? And then on 19, it's saying on the diagram below, indicate the injection site for the 2-in-1 vaccination. So if we're giving him a 2-in-1, all you need to do is pop in here, wherever it may be, where your X could be. Now, if for, I think we can on these ones pop in with an X, but if you can't for whatever reason with an X, you can highlight with a different color. So, you know, we could say, oh, it's there, or no, a rump's a really good spot where he's got a lot of muscle there, we'll give it there. Or actually, no, the neck's the best spot to be giving it, and I'll choose to give it there. So have a read up on that one in your learner resource and can mark that in. Explain the difference between giving a subcutaneous and an intramuscular injection. So location is the key point we're looking for there. Where would we give a subcutaneous injection? Where would we give an intramuscular injection on the horse? 21, you pick up a hoof to clean it out. You notice that George needs reshoeing. What safety procedures would you follow when you're picking up his foot? And then how would you report the need for being reshod? So yeah, speaking to someone, documenting it, how would you go about that? 22 is asking you to label the parts of the hoof. That may be, again, one that you're familiar with from previous tasks that you've done. So hopefully that's a nice straightforward one there. Then explain the function of the frog, which you touched on before with the bar shoe. So yeah, what's the importance of the frog within the horse's hoof? What's its role? 24, a little bit of maths. So George weighs 540 kilograms and he had to be wormed at a rate of 5 mils per 100 kilograms. So how much do we need to worm him with? So we're timesing our 5 mils by our 540 kilograms to give us an idea of how much he should be getting. Sorry, 5 mils per 100 kilograms. So we need to work out for the 540 how many lots of 100 kilograms that is, and then times that by our 5 mils to come up with that figure. Describe how a horse with worms could be treated, include how you'd restrain them, how you would safely handle them, procedure for actually worming them, OH&S considerations, so just keeping yourself safe, and then how you would monitor the treatment and effectiveness. How do we know that giving them a worming paste has done what it's supposed to do, or is helping to keep the horse protected and covered? So there's 25 questions that you need to answer with that one. So it's quite a big assessment. There's a lot of questions within that one, but all of those answers should be available to you within your learner resource. But definitely for any of them, if you're unsure, feel free to shoot me an email or give me a call, or even touch base with Nina. Either of us is fine. But yeah, you should be able to work through that one as you're going through the learner resource. The learner resource is a big one for these 2 units. It covers quite a lot of information. So there's quite a bit to be able to look through there. Cover sheet, same deal. Then the annotated photos, just with that one, it's just, sorry, I'll just get up to the top. So you're required to provide annotated photos which clearly show you carrying out the following aspects of horse care, or you come along and do the prac with us at GoTAFE. So it's fine either way, but this will just show you exactly what you're needing to actually do within your prac or your annotated photos. So carry out a pre-activity risk assessment. So that's included within this learner resource. Apply with items from your first aid kit, stable bandage to a front leg for an injury, and provide 3 to 5 annotated photos. Now you don't have to have an injury to bandage, just have to be able to show you how you would bandage an injured leg. So it could be a cannon bone, for example. So the photos would be of you applying that, or again, if you came along to prac, we would get you to bandage one of the horses here. So that's on one horse. Then on a different horse, applying a hoof poultice to deal with an abscess. So there's two different lots of bandaging that you need to demonstrate, and then provide a photo of your first aid kit and detail the items that are in it, their use, and how you maintain the kit. So yes, that is a double up on one of the questions from your short answers, but this is actually you showing a physical kit that you utilize and explaining what's in it and why, rather than saying, oh, this is what I would choose to have in my kit. So that's covering the second part. Third part is take vital signs of two horses. So document your findings in the horse health record sheet. So that's another appendix within this assessment that you need to fill in for one horse. So you're expected to take the vitals of two different horses, but you only need to document it for one horse. You provide photos or come in for prac showing you taking at least one of the vital signs of two different horses. So let's say temperature on one horse and heart rate or pulse on another horse, or assessing respiration rate. That's a nice easy one without needing a thermometer and a stethoscope. So details or annotated photos of you assessing two different horses for two different vital signs. Part C, what vitals would you expect to see for a horse with colic? Would you, who would you refer this to? Document this under your annotation. So you've provided photos of bandaging, photos of assessing vitals. Then underneath you can say part C, for a horse with colic, I would expect to see this, this, and this. This would be reported to whoever you would report it to. Then D, what vitals would you expect to see with a horse suffering from shock? So which vitals, would you expect to see, I guess, different to other vitals? So, think about your mucous membranes, capillary refill color, your heart rate, temperature, those sort of things. Which ones are likely to be affected by shock or out of the normal range? And then who would you refer this to? And then again, document that underneath your annotated photos. Number 4, removing a loose shoe from horse 1 or 2. Using farrier tools and performing a basic emergency trim. So that's something that may be difficult for quite a few people to reenact, especially if they haven't got a shod horse. I know mine was always barefoot. So whether that's something that could be done at, work, or again, coming in here, and we'll have shod horses to be able to look at going through that process. Identify the tools and explain the procedure, what you're doing as you're removing it, and then outline why a horse may have shoes on in the first place. If you couldn't handle an emergency trim, so that may be me going at the moment, it's too hot and I can't be bothered, who would you refer the problem to? Who would you get to come in and do it for you that would be capable to deal with that problem? 5, simulate injecting a horse. So you don't actually have to inject a horse, but what you do have to do is give us videos or act out here at the TAFE going through the process of doing that. So preparing your injection, having the horse safely restrained, indicating where your injection site is, being in appropriate clothing and footwear. So do not need to inject the horse, but you need to demonstrate how you would go about doing that if you were giving it into the muscle. So if we're giving it into the muscle, where are the recommended sites for us to be able to actually inject it into the horse? Typically with adult horses, there's one main place, but I know with foals on studs that I've worked on, we would often do it into the rump because they had more of a muscular area there. For us, if we needed to give them, let's say, a penicillin shot, and they were really quite young, we would tend to do it into the rump area rather than the neck, especially because we struggled to restrain them in such a way that we could get to their neck. We'd have someone, with an arm around the chest, keeping a firm hold of them and keeping a hold of their tail, and then someone else would be administering through the rump, and that just worked easier for us. I have heard of and seen other people do through the chest muscles, to each to their own, but typically for me the neck is the site where we choose to go, which is the safest and easiest, I think. So you can detail that in number 5. 6, the same deal, except you're looking at a subcutaneous injection. So indicating again where you would go about administering that. It's going to be pretty much the same setup. So more than happy for you to utilize the same photos if you choose annotated photos and say, here's my PPE, here's my gear that I'm getting ready. The only difference may potentially be your injection site, because one's into the muscle and one's under the skin. So just looking at, documenting how you would go about administering that to a horse. 7, you have a horse that needs light exercise. They're coming back from an injury. Provide annotated photos showing you safely controlling the horse, hand walking them. So it's as simple as walking a horse. And so that may be one where you go, oh, that's easy for me to be able to demonstrate with annotated photos. You need to make notes under your photos of identify signs of lameness that would be displayed at the walk for a lame horse in your annotations. So you're looking at, okay, if you're safely controlling them and hand walking them, you should be commenting underneath with a photo of you leading them on the left-hand side. I've got my helmet on, I've got my work boots, or if you don't need a helmet in your workplace, that's fine. I'm leading the horse at the shoulder at the left-hand side, and because it is lame, these are the signs that I would be looking for with regards to its movement. 8, provide photos of you giving a horse hay or access to pasture to ensure it's able to consistently eat, to aid its digestion after recovery after an illness. So your annotations or your notes are on why consistent roughage, access to roughage is important to horses and their well-being. So if you've got one that's coming back from, let's say, colic surgery or something like that, you want to know that it's got something consistently moving through its gut that's not going to be too high in energy or other things that could potentially upset it. So really just needs to be a couple of photos of you, either taking a horse out into the paddock and giving it access to grass and closing the gate over, or throwing hay over the fence or popping hay in a feeder, and then documenting, the importance of them having access to that food. 9, with a photo or two of a horse, identify with annotations visible signs you would expect to see of external parasites. So for example, lice, flies, or bot eggs, what would they look like on the horse? Or how would we tell that there's a problem with flies on a horse? And then internal parasites, so worms. If a horse was infected by either of these, and then touching on body condition score. So all you need to potentially do for this one is it's a photo or two of a horse. You could just have, let's say, a side-on photo of a horse, and then you could be highlighting particular areas, like we might expect to find lice down the backbone of the horse. So you could, put an arrow to here and say signs of lice here would include A, B, and C. Flies, you may, circle around their eyes. They tend to really bug them in summer and get around the eye area. Bot eggs, where do we typically find those on a horse? So the little yellow eggs that you can see normally around autumn, I think, of each year, or late summer. So you could do circles. This is where I expect to find, bot eggs. Internal parasites, well, obviously that's inside the horse, but you can give a general idea of externally what may be going on. So they may be a bit ribby. They may have a pot gut. They may have coarse hair. So all of that you could point out on a photo of a horse, and then you can document underneath body condition score. Do you expect, if they've got problems with internal or external parasites, that their body condition would be outside of what's considered normal or good? So you can touch on that thing too, especially with worms. They tend to get a bit ribby, even though, we try as hard as possible to feed them up and keep them looking good. The worms can really mess it up for us. Then B, with annotations, visible signs you would expect to see of dental problems in a horse's condition and behavior. So again, same picture. What visible signs would you expect to see with regards to the horse's condition? So not so much, quitting food or head tossing, which are signs we would see of dental problems, but okay, if they're struggling to eat food, that's going to affect their body condition and their body score. So what would we expect to see for that? Final one, number 10. Provide 3 to 5 photos of you administering an oral medication. So for example, worming paste, could be applesauce, it could be molasses, it's just got to be something oral. And detail in your annotations how often horses should be wormed to maintain a low worm count, and how much you should give your horse based on its weight. So generally we look at doing that seasonally with worming them, but if we carry out a fecal egg count test and find that they haven't got a heavy worm burden, then we would choose to not worm them. But it's just saying how often should they generally be wormed to maintain that. And then based on your horse's weight, how much should you give your horse? So that one's completely up to you to determine what weight you want to use for that one. So whether you want to use George from assessment number 2 as your example, because you've already worked that out in one of the other questions, that's fine. Or if you want to make it a bit easier mathematically and say, I've got a 300 kilogram pony or a 600 kilogram horse, that's fine too. Just a bit of research on a worming paste and how much within that worming paste needs to be given to horses. So most that you'll buy, you'll find that they cover up to, I think, 700 kilogram horses now. So if you're doing a 350 kilogram pony, you'd only be giving them half of that drench. So just taking that into account as you're working out how much to give them. And as I said, if you don't have access to horses that are suitable to complete the above, then we can look at doing a prac next year, and that's perfectly fine. If you do want to use horses that you've got access to, just let me know, because we'll need to get a safety and equine form filled out to know that they're suitable for you to be demonstrating these particular things on. And then underneath here, we've got a few different appendices. So Appendix 1 is your pre-activity risk assessment that covers question number 1. And then Appendix 2 is your horse health record sheet that needs to be filled in for one of the 2 horses that you're taking vitals on. And then underneath that is just an example of how you may go about doing annotated photos. So this one's looking at catching, leading, and tying up a horse, but it shows you a photo in appropriate horse gear. She's got gloves on, helmet, and then underneath she's saying, okay, collect the correct gear from the tack, e.g. a full-sized halter and lead rope. So that's something you may consider for George. You know, what size head collar and lead rope do you need for him? Ensure you're wearing PPE, so helmet, boots, well-fitting clothing. Gloves are optional. So just a couple of sentences underneath the photo to explain exactly what you're doing or the importance of what you're doing. And it tells you within that information above how many photos to provide for each part that you're covering. Now, lots of talking from my end. Any questions on that?
No, not yet.
Okay, alrighty. So that's the assessment tasks in general. So that covers 3 of those. Now, I am mindful that we're already at 3:30. That's just flown by. So what I'll do is I'll just quickly have a look at this workbook. Can you see that on your screen?
Yep.
Okay, so this learner workbook, don't panic, but it's 110 pages. So there is a lot of content within it, but the first couple of pages are not necessarily needing to be read. Okay, so unit overview we're looking at on page 4. It says, welcome to ACM PHR 302, which is maintain health and welfare of performance horses, and SIS OEQO 304A, apply first aid for horses. So it's your 2 first aid units together that are being delivered in this cluster. And this, these dot points show you what should be covered within this workbook and what you're being assessed against. So you can read through those as you have the time. Prerequisites for 302 is handle horses safely. Your maintain horse health unit doesn't have a prerequisite, or it's the other one. One of the 2 doesn't have, sorry, apply first aid doesn't have a prereq, but this one does. Duration of this cluster is 8 weeks. So you've got 2 months to be looking at covering this. But at the end of the day, when it comes to the practical, if you're opting to do that here at GoTAFE, that'll be sometime next year when it's hopefully not too hot, and we'll have an opportunity to go through that. So don't panic about assessment number 3 if you're planning to do that here at GoTAFE. That'll probably happen after the 8-week mark, but that's not of concern. That's just due to weather and COVID. We'll make it work when we can make it work. But the other 2 assessments, multiple choice within the first month, should be handed in, and assignment within 6 weeks. Unit objectives, that's pretty much a double up of the information that was listed above on page 4. Once you've completed these 2 units, you should be able to, and then it lists the dot points there. Nina's and my contact details are in here, or just the equine department in general. We both have access to that email account, so if you need to contact us at any point, you're welcome to do so. Now, this book is divided into 6 topics, so you may like to, I know, try and tackle within the next week the first couple of topics and know that you're making a good dent in the workbook, or you may like to do it based on page numbers. I'll tend to, divide that by, let's say, 4 weeks and go, okay, I'll do the first 27, 28 pages within week 1, the next close to 30 pages in week 2, and you'd get up to 110 by the end of your 4 weeks. And at the same time that you're reading through that, have your multiple choice questions there available to you, so you can be looking at how you'd go about answering those questions. Same deal with your short answer, because normally I encourage you guys to get through the workbook in the first 2 weeks and then tackle your assessments, but this is a large workbook. Oh, you know what? It's okay. We've not got 4 weeks. We've got 8 weeks. I'm jumping ahead of myself. If you try and tackle this reading within the first month, then you know that you've got the next 4 weeks to tackle your assessment items. So as long as you've been able to finish the content and deal with your multiple choice questions at the 4-week mark, then you should be traveling pretty well on track for things. I won't go through the content today just because we've run out of time, but I will set up another webinar for us to be able to go through. But it tells you, as we've been through, you've got 3 assessment tasks that you need to do for this particular unit to be deemed competent. And that's your general information about how to use this workbook. So what we'll do next week is start on topic 1, health and welfare. You're more than welcome to read ahead, but we'll be looking at from page 9, and we'll try and get through topic 1 out of the way next week. It's quite a large topic. I think number 4 and number 6 are quite short. So if you want to feel like you've finished some topics already, maybe go to those 2 first, and you can just go, right, I've read those 5 pages or whatever. But topic 1 we'll get stuck into next week and just have a general overview of that one, but you're more than welcome to read that in advance of us meeting together next week. Any questions about any of that?
No.
Alrighty, what we might do is I'll stop the recording. I'll let you get on with the rest of your afternoon, and I'll organise our webinar for next week. I'll just stop that.